next guest is the CEO of a metals play, as I understand it. ZEN Graphene Solutions. The CEO, Greg Fenton, is here. Let's bring Greg on. There he is. Greg, good morning. How are we doing today?
Good morning. I'm doing great. How are you doing, Spencer?
Doing fantastic. Fantastic. So ZEN Graphene, as the name would imply, right? We're talking about graphene. This is a metals play. We've seen a huge run up this year in the space. We've got your slides, guys. Let's bring them on the screen, and we'll let Greg here tell us about the environment right now and the company.
Thank you very much. Good morning, everybody. Thank you for joining us. I will make a small correction to that, Spencer. We started out as a metals play, as a graphite deposit, and then evolved into a graphene company. But we've really evolved further into nanomaterial sciences and IP development company. So we're really focused on intellectual property, both developing it and commercializing it. Today we just announced that we actually changed our name. So we've gone from ZEN Graphene Solutions. Our new name is now ZENTech, and that really is a reflection of how the company's evolved over the past 3 or 4 years with our focus on developing technology. So our new name is ZENTech. As I said, we're an IP development and commercialization company. We develop our own intellectual property. As well, we look to license third-party technology and commercialize that as well. We're really focused on the healthcare sector. We had a pretty substantial breakthrough last year where we developed a compound that we're basically trying to develop something for the fight against COVID-19, given some of the unique characteristics of graphene, which is one of the elements that we work with to a great extent. It has a very high surface area, and we looked at ways of actually doping the surface of this graphene to see if we could come up with something that was antimicrobial and might be utilized, as I said, in the fight against SARS-CoV-2. We were successful. We did develop a compound, and I'll talk about that in a couple of moments. As I said, we are really focused on the healthcare space. We have a three-pronged approach, or 3 pillars, as we like to say. We have a prevention pillar, so that's our ZENGuard antimicrobial coating that can be utilized on personal protective equipment, so gloves, face masks, gowns, bed sheets, etc., as well as for the indoor air quality market, so HVAC filters. The second pillar of our platform is a detection platform. So we have prevention, detection, and treatment. Detection is really, really interesting. We've acquired the commercial rights for an aptamer-based technology to detect numerous pathogens, including the SARS-CoV-2 virus, and I'll talk about that in a couple of moments. And the third pillar of our healthcare vertical is treatment. So the compound that we developed, the ZENGuard as we like to call it, can actually be utilized in the fight against certain human diseases as well. And we're very, very excited about that pillar because the compound, not only is it incredibly safe because it's just basic elements brought together, but it's very, very efficacious. We've tested it against numerous pathogens, and it has showed tremendous results against these pathogens. With this, what's very interesting about our company is if you think about a healthcare-focused company, because we have intellectual property, we have the ability to bring products to market immediately, and that's the 3 prongs of our pillar that we were talking about. Our ZENGuard, we're actually bringing to market as we speak. We are currently commercializing it. We hope to have the detection platform in the market some point early next year, and then the treatment will be a little bit longer to get to market. There's more regulatory hurdles we have to jump through to get that to market. But we have a beautiful progression of technology that we can bring to market over the next 3 to 5 years. So our ZENGuard antimicrobial coating, as I said, when COVID hit, we decided to put all of our efforts into developing something that could be used in the fight against the SARS-CoV-2 virus. We worked through the summer last year and came up with a compound that was 99+% effective against numerous pathogens, as I mentioned, including the SARS-CoV-2 virus, the virus that causes COVID-19. All the testing that we did was done at an independent lab, a BSL level 3, and our compound remained effective after 108 days. So we were pretty excited about this because we had discovered something that we knew could be utilized in the fight against COVID-19. We tested it against bacteria and fungi as well, and it demonstrated greater than 99.9% efficacy based on utilizing ISO standards. So we had found something that was incredibly broad spectrum, and we knew had implication well beyond COVID. This just wasn't something that was going to be, COVID and then gone. We knew that it would have a long-standing ability to remain relevant in the market. So as I said, this can be utilized on personal protective equipment, filtration media, so HVAC filters. We're exploring utilizing it on paper, cardboard surfaces, and it's a true catch and kill mechanism that we have. The nature of our compound, for most of you know that most viruses or pathogens actually travel in water droplets. Our compound actually grabs onto those water droplets and holds them and then goes to work actually killing the pathogens that are embedded within the water droplets. So it is a true catch and kill, and that has significant impact when you're looking at filtration efficiency of masks. It improves the filtration efficiency while making them safer, not letting those pathogens through. We have filed global provisional patents for these compounds. We're very, very confident that we'll be awarded full patent for them, just given the level of efficacy that we're seeing. There's nothing that exists today in the literature that's anywhere close to the efficacy that we're able to achieve with our compound. So we know it is unique and distinct from anything else that's out there. So that gives us a real leg up on the market and will give us significant protection moving forward, having a best-in-class product. If we talk about the markets, and this is where it gets really exciting from an investor's perspective, we did a fair amount of research on the size of the markets, and we believe the personal protective equipment market is greater than $52 billion per annum. The indoor air quality market is even larger at greater than $66 billion per annum. And we can apply our coating to masks, gloves, gowns, as I said, and onto air filters that are in your house or in your office or in schools or in any building. It doesn't require a retrofit. It's just simply spraying our coating onto the existing filtration mechanism, and then our coating will do the rest of the work to actually kill the pathogens. So these are very, very large markets. We're currently entering both of those markets. We do have commercial contracts in place, and we're rapidly building out our distribution capability to get it to a much broader audience. It's not just in North America, it's globally that we're establishing our distribution relationships as we speak. So to give you a sense of the size of the market, the disposable mask market is obviously incredibly large right now due to COVID. We utilize data from one study that estimated 1.5 trillion masks are being used during the single-use masks are being used during the pandemic. But of course, as COVID starts to wane, as we develop better vaccines, again, there will be a steady state that will be much lower than the current usage. And we made a fairly conservative estimate of roughly 60% of the 1.5 trillion that are currently being used. So that gets us to just somewhere over 900 billion masks per annum that we believe that will be utilized. So what we did here is we showed if we were to earn a gross margin of between 3 to 6 cents per mask. So we actually provide the coating to the mask manufacturers and they apply it to the masks. We charge them on a per mask basis. So if you look at the graph on the right-hand side here, what we've done is we've made various market penetration assumptions. So you can see on the far left, it's a 0.1% market penetration, moving to the right, 0.5, 1%, and a 5% based on the 900 billion masks per annum. And then you can see the different color-coded bars. That's based on an assumption around the actual gross margin that you could make per mask. We have now entered the left side of this graph, given that we are currently shipping commercial quantities of our coating now to mask manufacturers. And this just gives you a sense of the size of this potential given your various penetration rates. So we're very excited about this. This is going to be a significant market moving forward. We do have a best-in-class product. Our product actually enhances the efficiency of existing masks while killing the pathogens. So we're seeing a tremendous amount of demand and interest in our product. Recent milestones, we recently just received approval from Health Canada. That's the first regulatory body that approved our ZENGuard coating. So we proved the efficacy and safety to Health Canada, and that's on ASTM level 3 masks, which are the highest level filtration masks. We went through rigorous testing to get us there, but we went through the process. Now that we're approved, we're going for similar approvals in other jurisdictions, including the US, Europe, and other countries around the world. So we're really, really excited about that. As I said, we've delivered our initial ZENGuard to Trebor RX, one of our mask partners, and we've started the revenue generation phase of this business. We're going to continue to commercialize and produce. We're going to have the ability to produce up to 800 million mask equivalents per month of coating at our facility in Guelph, Ontario. That should be online by the end of this year. So we're very, very excited about that and are building out tremendous capacity based on the demand we're seeing. The second leg of our healthcare platform that I mentioned was this detection platform. We've licensed technology from McMaster University in Hamilton, Ontario. They developed a synthetic molecule that can target a specific pathogen. In this case, they designed it specifically for the SARS-CoV-2 protein virus, and it was basically targeted on the spike protein that actually comes off the SARS-CoV-2 virus. This is a really, really simple, safe, fast, accurate, and scalable detection technology. It's saliva-based, so none of those invasive swabs that have to go up into your nose. We can actually just take a sample of saliva, so it's much easier to use with less discomfort. It's incredibly fast. Initial test results we can get in 7 to 10 minutes. Provide your saliva sample, and within 10 minutes, you know if you're COVID positive or negative. It's accurate. It's an impedance-based detection, and that allows us to have very, very low detection limits, similar to current PCR tests, which are the gold standard. The 36-count PCR test, our test is as sensitive and accurate as that. It's easily scalable. Aptamers are synthetic, and they can be produced. And we can target numerous different pathogens. It just doesn't have to be the SARS-CoV-2 virus. We can target STDs, HIV, strep throat, even some cancers. So it's really exciting. Again, this goes well beyond the current pandemic. This will have staying power and longevity. And it's very accurate, very easy to use, and we will be able to differentiate on price as well. So we're incredibly excited about this. It's affordable, and it's a real game changer in the point of care testing space. So we're really, really excited about this, and we anticipate. It's always hard to give timelines, and I don't like to do it, but we think we'll be in the market in early 2022. The third leg of our healthcare pillar is a little bit longer to get to market, but that's as a treatment. When we initially discovered our compound, We had the chief microbiologist at Mount Sinai Hospital in Toronto do some efficacy testing for us on different bacteria and fungi. What he found was that we had an incredibly low MIC, or minimum inhibitory concentration, meaning that it required a very, very small amount of our compound to actually kill these pathogens. So based on this initial early testing that he performed for us, he suggested that we should actually look at utilizing this compound in the fight against human diseases. The MICs that we were achieving were much lower than existing antibiotics. So that was incredibly powerful for us because we already knew that we had something that was really, really safe based on some cytotoxicity testing that we had done through various labs. We actually tested it against lab rats, and the safety profile came back almost perfect. They were dosed with huge amounts of our compound and it didn't affect them at all. So we know we've got something that's very, very effective against different pathogens and in very small amounts. So this has significant implications for us. We will be moving to hopefully phase 1 human trials early next year on a couple of different conditions. There are numerous conditions for us to test, but we have to pick a couple and go with those. And we're picking the ones that we think will have the highest probability of success against, and that will give us the quickest time to market. Those are obviously very, very huge markets, greater than $100 billion US per annum. So again, we think we've got something that's very unique, and we're really excited about where this is going, and we can't wait to see the results because all the testing we've done to date have really proved up that we do have something very, very significant and special here. So upcoming catalysts for our company. On the prevention side, we're going to build on the approval we got from Health Canada. We've now got one of the leading healthcare regulators in the world supporting and approving our product, so that will make it easier for us to move into other jurisdictions. We're going to continue to commercialize our ZENGuard coating for the PPE market, for masks, gloves, and indoor air quality. We are going to be listing on NASDAQ. We've already put our application in, so we're listed on a Canadian exchange now in the OTC market in the US. We are going to move to NASDAQ either very late this year, so late November, early December, or at the beginning of the new year, just depending on the approval process. So that should be a significant catalyst for us. In terms of detection, we're doing additional testing. We're doing the commercialization. We're working with commercial partners now to produce the tests and the components of the tests that go into it. So we're making tremendous progress there, and we hope to be in front of the regulators for approval very, very soon. The treatment I just alluded to, we've got milestones related to our topical applications, and we're going into additional animal trials and hope to be in human trials early next year. And then our future pipeline, we have a tremendous amount of potential in our pipeline, both healthcare related and non-healthcare related. We are working in the coating space, we're working in fuel additives, we're working in the battery space as well. So we truly are an intellectual property development company, and we look to commercialize that intellectual property. We're really focused on the healthcare space now because that's immediate commercialization and monetization of our assets, and we look to continue to build that out as we move forward.
All right, Greg, I think we got a couple questions here in the chat, if you're ready for them. All right, the first one is, are tests currently available at airports?
Our tests are currently not on the market, but that is one of the largest markets that we've identified for our tests. Our airlines, cruise ships, remote doctor's offices, even regular doctor offices in urban settings, but the remote access that this will provide will be tremendous. Even things like warehouses where you have thousands of people coming into work every day, it'll be very simple to administer this test and have a result in 10 minutes.
And the last one before we hit the clock here is, do you need a Health Canada approval for the HVAC filters?
It will not be a Health Canada approval. It actually falls under Environment Canada, and there is an approval process that we need to go through for that as well.
Okay, Greg Fenton has been on with us. He is the CEO of ZEN Graphene Solutions. Greg, a pleasure. Thanks for coming on today, and very interesting story.
Thank you very much.